Okay, Samya, that's fine. We can see it.
Hello, sir.
Hello.
Hello, everyone. The topic of my presentation today is applicable regulation and reporting responsibilities for adverse events. Before starting my presentation, I should endorse that it's very difficult topic for me, and I have developed up my presentation around the adverse events that are related to our clinical practices, and I must say that this topic seems simple, but the topic is quite vast. It's difficult for me to summarize this topic in 5 slides, but I will try my best to summarize and simplify my presentation. So moving forward to the definition of my topic. An adverse event is an unfavorable and unintended sign, symptom, or disease temporarily associated with the use of medical treatment or procedure that may or may not be considered related to the medical treatment or procedure. This definition is developed by Common Terminology Criteria for Adverse Events, Version 4, 2009. So this is the definition of adverse event. Before this, we have heard about reporting of adverse events or unwanted events related to transfusion of blood products and the system. And the system of program that regulates them is known as the hemovigilance. But according to WHO, its definition is actually to identify and prevent occurrence or recurrence of transfusion-related unwanted events, to increase the safety, efficacy, and efficiency of blood transfusion, covering all activities of the transfusion chain from donor to recipient. Among these programs, the famous one is serious adults of transfusion, which that has been developed in UK. The other one are that transfusion reaction in patient from Netherlands, and also in Canada, transfusion transmitted injuries surveillance system. In India, it is HVPI, Human Vigilance Program of India. So these are the example of my presentation, but sir, hello, sir.
Yes, Samya.
Sir, these slides are opening slow. That's why So these are the example of the adverse events: worsening of pre-existing condition, change in the physical sign or symptom, abnormal exam, test or procedure, and concurrent illness, and also subjective reports, change in the vital sign or physical exam, abnormal lab value. Sir, I don't know, but the slides opening slow.
Well, but it looks okay.
Okay,
Oh,
example.
Yes,
complication from surgery are also example of adverse events. Psychological symptom or harm, and any change in the vital signs, also anomaly or birth defect comes under the example of adverse events. But it's very important to know that to report adverse event in transplant setting, like ours, because the recipient will be receiving because the sir, hello, sir. Hello.
Yes.
Sorry, sir. Because it's because the recipient will be receiving potentially toxic regimen and a significantly regimen of blood product, and it's also blood product is also blood reactions is also under the example of adverse events. Serious adverse events. This is the form of the another form of the adverse events, that is serious adverse event. Serious adverse events or suspected adverse event is considered serious if any of the following outcome occur, like death, life-threatening adverse event, inpatient hospitalization, persistent or significant incapacity or substantial disruption of the ability to conduct normal life, and also congenital anomaly and birth defect comes under the example of serious adverse events. So why reporting adverse event in transplant setting is important, as Ma'am Ezra also explained, because a recipient will be receiving potentially toxic preparative therapy. So significant regimen-related toxicity is anticipated. Also, blood products, substantial motility and non-engulfment of the transplanted product. But the data should be reported and documented in appropriate form, like our local and also HUTA form, Drug Regulatory Authority of Pakistan, and also international network like BMT Plus, CIBMTR, Center of International Bone and Marrow Transplant Research, EBMT, JCI. But in addition to that, the real database system like BMT Plus is also the site of reporting of adverse event. And it is not necessary. We should know that, and we should remember that it is not necessary to report expected or non-serious adverse events like non-engulfment complications that are attributed to the natural cause of the disease, chemotherapy, and but the role of proper consent taking and informing patient become more important at this point. The all serious adverse events should be reported if there are any serious reaction occur within 24 hours of the blood transfusion or infusion reactions. So report all serious adverse events, if serious infusion reaction within first 24 hours after the infusion, and serious infusion reaction within first 48 hours of the reactions. And also recipient sepsis related to a contaminated product. This is also serious adverse events, and we should report it before first 48 hours of the infusion. So the reporting and the documenting adverse events, we should know basic terminology like event, grading, relationship, expected, serious, action taken, duration, and outcome. For reporting of adverse event, the terminology which is used to describe very important. Inaccurate or inconsistent reporting of the event may lead to missed safety signal. Example like wheezing, bronchospasm, asthma, like bleeding, and also SOP, hypertension, and blood pressure, etc. And also for this purpose, we may also be used medical dictionary for regulatory activities. So grading severity, common terminology criteria for adverse events created by the Health and Human Services, National Institute of Health, National Cancer Institute. So this slide shows the severity of the grading that in grade 1 is mild, which is asymptomatic, or and in this grade mild symptom occurs. And in this grade 1 intervention not indicated. In grade 2 is moderate and minimal intervention indicated. And in grade 3, which is severe and immediately life-threatening, and also prolonged hospitalization may be needed. And in grade 4, life-threatening, urgent intervention indicated. And grade 5, death related to adverse events. So this is the slide which show the, we should also know the serious versus severe adverse event. Example to explain serious versus. So severity refers to the intensity of the event, and seriousness is a guide for defining regulatory reporting obligation, and which is also based on the patient outcome or action. usually associated with the events that threaten a patient life or functioning. So if the patient have onset of migraine lasting 2 days, causing subject to stay in bed and miss work, unable to care for children, this is not life-threatening, no hospitalization needed, no persistent disability. So it is not serious, but the intensity is severe. Relationship is there are reasonable possibility that the event was related to or caused by the investigational intervention. And we should also grade it from 0 to 4. In 0, not related; 1, unlikely related; in 2, possibly related; in 3, probably related; and in 4, definitely related. This is the picture which show, of course, of the relationship and correlati. So move on to the next slide, that is expected versus unexpected. Expected adverse events will be described in protocol and informed consent, whereas the unexpected adverse events are not listed in the protocol and informed consent and not consistent with the risk of information described in the general investigational plan. Expected versus unexpected examples. If the consent form or the investigator brochure referred only to the elevated hepatic enzyme or hepatitis, hepatic necrosis and would be unexpected by the virtue of greater severity. And if the consent form or the investigation brochure listed only CVA, but cerebral thromboembolism and cerebral vasculitis would be unexpected by the virtue of greater specificity. These are the example of expected versus unexpected. So action taken. Action taken or treatment may also grading from 0 to 5. 0 show no action taken, and in 1 dose modification, and in dose 2 medical intervention, and in grade 3 hospitalization needed, and in 4 intervention discontinues, and in 5 other. So the duration and outcome, duration start and stop date, and outcome may be it can be resolved ongoing or resolved with schedule. Reporting responsibility. Reporting responsibility is very important and very necessary for us. All adverse events should be reviewed and signed by a qualified clinician and also investigators, and know the reporting requirements and timeline for your institution and study protocol. Okay, come on the next slide, move on to the next slide, that is reporting time frame fatal of life-threatening unexpected adverse events. Certain adverse events may be sufficiently alarming so as to require very rapid notification to regulate in countries where the medical product or indication, formulation or population for the medicinal product, and these are still not approved for marketing. And fatal or life-threatening unexpected adverse event occurring in clinical investigation qualify for very rapid reporting. Okay, there is the DRAB method which we are used in Pakistan to report expected, unexpected and expected adverse event. Regulatory agencies should be notified by telephone, by email within as soon as possible, or but not later than 7 calendar days after first knowledge. And but by the sponsor that a case qualifies, followed by as a complete report as possible within 8 additional calendar days. This report must include an assessment of the importance and implication of the findings, including relevant previous experience with these same or similar medicinal products. Sorry, how to report for drug-related adverse events? The CIOMS Form 1. CIOMS, actually Council for International Organization of the Medical Sciences, has been a widely accepted standard for expedited adverse event reporting. It is important that certain basic information, data elements, when available, be included with any expedited report, whether in a tabular form or in a narrative presentation. All reports must be sent to those regulators or other official parties requiring them in countries where the drug is under development. So this is the DRAP method, Drug Regulatory Authority of Pakistan, which we used to report the adverse events of drugs by method of electronic reporting system, by our online official website, or reporting through mobile application or manual reporting system. We report it through yellow reporting form, and we emailed it to official addresses. So this is the method which I taken from DMT to report adverse event. This is the incident report. In incident report, we should mention the incidents code, and we should mention a center in which center the adverse event happened, and also the severity of the adverse event, whether it is important, not important, etc., and who is accountable, who is reasonable, and the also related record, also username. We form this, we fill this form, and the also in this incident report we also mention in detail why this incident occur, and we also I just go through the basic window of the incident report of adverse event and specific code given below. And while working on DMT Plus, we use this incident report to incident report for adverse events. Okay, reporting of the adverse event in CIBMTR. Center for International Blood and Marrow Transplant Research. We report all qualifying recipient adverse events and our product complaint event on our recipient of cellular product, and also we use the form NET3 is a system used by the event reporting system. So why do we collect adverse event data? This is very important. To determine the safety profile, of a drug or device, or to evaluate the risk and benefits, to provide information for the package insert, and determination of safety is often one of the primary protocol objectives when evaluating new therapies. But the most important thing to prevent such incident reports to happen in, because to prevent such incident to happen in the future. So the reporting responsibility, investigator and IRBs must promptly report information of adverse event problem that involve risk to subject or others. These are the references of my presentation. Thank you so much.
Thank you. Thank you, Samia. I know that was another very difficult topic, I understand. We have to deal with it because it's, as you know, it's part of the list of core competencies that we need to address, even though I understand it's quite difficult. But we all know that adverse event reporting or accident incidents, it's a critical part of the job of any nurse, not necessarily an advanced practice provider. Anyway, thanks a lot. Any questions or comments before we move into the poll?
I think, sir, no one have any question.
Okay, can you stop? I don't know. I don't see how I can stop from sharing because I cannot pull out the poll. Maybe I need to. You need to stop sharing.
Okay, Samya. Samya,
Ma'am,
please.
I stopped screen sharing.
Okay.